Try to go down, and I'm going to go along with the schedule that we use in our office, so it's kind of chronological. Well, the first one the babies get is before they leave the hospital after they're born, the hepatitis B. And I'm going to pick your brain on each of these vaccines.
Okay.
I'm going to sit back and learn something.
Okay.
Hepatitis B for babies. Why do we give it? What's it all about?
We give hepatitis B to babies to immunize them as early in life as possible. Hepatitis B can come from blood and body fluids. It oftentimes comes by blood transfusion or sexual contact, but it can also come from casual contact in a family where someone has hepatitis B. And oftentimes people who have hepatitis B may not know they have it because it can be silent for many, many years. About 20% of people who get hepatitis B will develop a chronic form of it, and some of those people will go on to die from cirrhosis or liver cancer. So we want to protect children as early as we can in life.
And it seems like it's not a prevalent disease for infants and children because they don't have symptoms. I think one baby we diagnosed it in. Now the mothers are screened, we're alerted, so we kind of know, and if the mother's positive or infectious, we treat. But it is a very occult disease in infants and children, and it's only later on. So that's the main reason to give it to babies, is they're not sexually active, but we want to prevent the hepatitis that can cause liver cancer or cirrhosis later in life. The babies actually have a nice visit at 1 month. We don't give them any immunizations. And everybody's happy. At 2 months, it hits the fan. They get, now we give a combination vaccine with 3 components. It has the DTaP, it has the polio, and it has the hepatitis B. And the A in front of the P is pertussis, whooping cough. The A is just what you said. We don't give a whole bacteria ground up with a lot of reaction. It's acellular. We just take a little bit of the cell, and that is just as effective with a lot less side effects.
And it took a long time to figure out what part of the organism would stimulate the best response. And that's why that vaccine took a long time to develop. And then when the vaccines are combined together, they all have to be restudied again to make sure they're as good separately, as good together as they are separately. And so it takes a lot of work to do this, but now instead of 5 shots, kids get 1 for those 5 diseases.
Well, and the pharmaceutical companies are always, you know, they're sort of mistreated and put down as being greedy and money mongers, but they have done such a wonderful job of making these vaccines available and safe and effective to prevent these diseases. Well, the DTP, diphtheria, I mean, it still is around. It hasn't gone out of existence. I have never seen a case of diphtheria, but it certainly, when you read about it, it can kill. And it's good to keep giving it because the disease is around and it still pops up.
And you need to keep your immunity up over the course of your life, because your childhood immunity that you got from your childhood vaccines may wear off as you get older. So you need to continue to do that every 10 years as you pass on to the internists.
Are the internists doing a good job of keeping
We are
people
trying
up to
to
date?
teach them that.
All right.
And I think with some of the tools we have available now, they will be doing more with immunizations than they have in the past.
Well, I say goodbye roughly at between 18 and 21, so I don't worry about where they're at when they're 50 and 60. But tetanus, I've only seen 1 case in my whole life, and it was in medical school. It was a farmer who probably had never had a tetanus vaccination, and he was in a hospital bed, and the professor was making rounds, and he was standing there like this, and he couldn't open his mouth, and he truly had lockjaw, and he died. Because, again, now I think we have a lot better supportive means, but he died of tetanus. And we don't give so many tetanus boosters anymore.
No,
Kids
no.
used to get too many, I think, every time they scraped or cut. And whooping cough is making a comeback. And we see a lot of whooping cough now, not in infants and younger children, but we see it in the older the school-age child and the teen because their immunity has waned.
Right.
And they get it, and they have this nuisance cough for 8 to 10, 12 weeks, which they're not happy about if they're playing varsity basketball or cheerleading or in a ballet and they're coughing away. It's a major league nuisance.
The Chinese word for whooping cough is 100-day cough, and it's a very apt description of how long people can have symptoms with it. It's the most common of all the vaccine-preventable diseases right now, but we hope over the next several years, now that we have a form of this vaccine for adolescents, that we will give them immunity when they're little and boost that immunity throughout their life so they won't get whooping cough, and we'll see less of that.
I've seen infants with bad whooping cough that didn't get the vaccine, and they were so terribly sick and coughing away.
And nothing makes you feel more helpless than to watch a child who has whooping cough, because there's really very little that you can do to help them.
We, believe it or not, we have about 5 minutes left here.
Okay.
So I want to hit on hepatitis A, the newer vaccines. I think polio, we don't give the oral live vaccine, we give a killed inactivative, so it's absolutely safe. And I saw, you know, in medical school, young people in iron lungs before there were ventilators. Franklin Roosevelt in his wheelchair as president. Polio is an absolute disaster.
And
it's preventable.
this may be a vaccine that we won't give forever and ever if they can be successful in eradicating it from the world. But right now there are still 4 countries where it is, and again, we're only a plane ride away from that disease.
Well, I'm going to kind of skip through chickenpox, MMR. I want you to say something about hepatitis A and rotavirus and the one that we're kind of talking about for teenagers now.
Okay. Hepatitis A, I just went to a conference that was sponsored by Centers for Disease Control, and one of the experts in immunizations stood up and said, the only people who really should get hepatitis A vaccines are the ones who eat. And that's everybody. Hepatitis A is a foodborne illness. We see in the news periodic outbreaks of hepatitis A related to whether it's contaminated onions or other greens or contaminated shellfish. This is something that can make you very sick. For an adult, there's very rarely people who die from it, but it takes a month to get over it, and it's very easy to pass around. The rotavirus is a very bad cause of infant diarrhea all over the world. We're fortunate in the United States to have good access to IV fluids and hospital care, but around the U.S., around the world, rotavirus probably is responsible for 1 million childhood deaths every year. We can save children in our country doctor visits, ER visits, hospitalizations by immunizing against this very common cause of diarrhea. And it's oral, so it's not a shot.
And we give it at 2, 4, and 6 months.
And we give it at 2, 4, and 6 months.
HPV, human papillomavirus.
The virus that causes cervical cancer is one of our newest weapons to help improve long-term the quality of life. If we can prevent women from getting the major virus that causes cervical cancer, we're going to make a lot of women a lot more healthy, and we're going to save a lot of money down the road. This is a vaccine that is passed by, this is a virus that is passed by sexual activity, and we want to make sure that kids are immunized well in advance of sexual activity so they will not be infected with this virus.
And we're not encouraging sexual activity. I'm a big advocate of abstinence.
Right.
And if a boy and a girl are virgins when they marry, they have no worry about human papillomavirus.
Right.
The last one is flu vaccine, and there always has been a risk category. We've given it always to asthmatics and kids with congenital heart disease and diabetes and kidney disease. They were at higher risk for getting flu. Now we give it to all the 6-month-olds and over up to age 2 as a risk factor. I think it's a safe, effective vaccine, and I recommend it for everyone who will receive it.
Absolutely. What people have appreciated more in the last several years is that there's actually a higher death rate from influenza for children under age 2 than there is in the elderly. And if we can protect those children, again, will prevent deaths and major hospitalizations. Last year in the U.S., 55 children died from flu.
We're down to our last minute, and I want to thank you for coming on. I want to mention that we're going to show website page and website access. This program and a whole series of programs that I've done are on my website, raisingchildrenwithgod.com. And I want to thank you very much for coming on tonight.
Thank you very much for having me. The immunizations have changed my practice over the 30 years I've been doing pediatrics. I think they're the most important advance in the last century.
And I agree. And I want to thank Shrewsbury Public Access Television for giving us this opportunity to have an educational program. And I'd like to thank God. I always want to make sure I mention him before we're over in case you get mad at me, for giving us our career and our knowledge and this opportunity too to help parents and to help infants and children. And I hope this is helpful.
Yes, thank you.
Thanks.